Friends, welcome back to my channel Alpha Physio Pelvic Care, all things pelvic health. My name is Anastasia Varva. I'm a pelvic floor physiotherapist. I'm practicing here in the very hot and sunny Cyprus and also online. And I would like to let you know that everything that I'm talking here in my channel now for almost a year is coming all from my practice. So I don't just take out imaginary topics. I take everything that comes from my practice and share with you my professional experience. And today we're going to talk about a very hot topic that people, namely women, come to me after birth, and it is I don't have orgasms after birth. Yes, orgasm can be and is a very important part of people's sexual life, and I really appreciate that. It might not be for everyone, but for someone who was actually happy with their sexual life and experiencing orgasm, suddenly going off not having any, it can be a big blow to their self-confidence, also to their relationship with the partner, and people are confused. Why is this happening? Am I defective? Has my baby destroyed my body? And so on. There is a lot of questions why I don't have orgasm. So today I will talk about 4 main things why you might not have orgasm after giving birth and what to do about it. I know you're watching my videos and sometimes you just forget to click that like button, so I would really appreciate if you enjoy this video to click that like button, comment, ask your questions, and also don't forget to subscribe to my channel not to miss any new videos. Let's begin. Number 1, why you might stop experiencing orgasm after giving birth. And sometimes it's a pure technicality. It is an injury, a birth injury. Whether it's an injury to your pelvic floor, so muscle overstretch, even if you were lucky enough not to have any tears, not to have any cuts, there still is a lot of muscle strain and overstretch, and these muscles contains a lot of structures such as blood vessels, such as nerve endings, and these also get injured because birth, it is a certain type of injury to the body. If you did have a tears, it can be stitches, it can be overall swelling around the perineal body. As you are healing, things might get better, but if you are kind of not doing anything about it and you start to go back to intimacy and you notice that I'm trying and I used to have orgasms easily and I can't have one now, or I can have one now, maybe it is not as strong, or it takes me a lot of time to achieve one. One of the reasons can be is injury to your perineum. It can be the scars. It can be the fact that the perineal body, here the area between your vaginal opening and anus, got shorter and the muscle attachment point got less. So you have less muscle contraction during orgasm, so you don't feel it as much, or you struggle to get the stimulation you need because of that injury and overstretch. If you had a cesarean section, same thing applies. You had injury of your abdominal area, and abdominal area is not that far away from your uterus, and your uterus has been cut as well. The scar tissue is formed, and during the intercourse you might be in pain. And when we have pain, well, most of the people do not kind of connect pain and orgasm. There are some exceptions, but usually when it comes to postpartum pain, usually they don't go very well with orgasm. What to do about it? I'm a huge advocate of pelvic floor rehabilitation, visiting pelvic floor physiotherapists so that you learn how to do your pelvic floor exercises correctly, to get yourself a program. You give birth, whether it was vaginal or C-section, is good to go and check those scars. Check those scar mobility, learn some scar massage, whether it's your perineal scar or if it's your cesarean section scar. Start to do those pelvic floor exercises to get your muscles back in shape, to recover from the injury. Remember, if you have an injury to your knee, to your shoulder, most of the time you go to the physio or to the doctor and they will say, Do some rehab exercises after initial rest, after initial swelling has subsided. Same goes exactly to the pelvic floor. You can start to get that working muscle input into your nervous system and therefore improve your chances of having an orgasm. Number two is usually the endocrine status of women after birth. Whether you breastfeed or not, usually after birth, your prolactin, the hormone that produces milk, is high. Even if you decide not to breastfeed your baby, it will still be quite high at the beginning, at least, and it can still stay on a higher level within first 6 to 12 months after giving birth. If you breastfeed your baby, it will be still a bit higher than a norm, and therefore prolactin can reduce the sex drive. It can make us kind of more tired, more emotional, and therefore we will not have that drive where we actually can easier reach orgasm when we are having an intercourse. When there is low testosterone, low sex drive, well, you have just less chances of having orgasm. So what to do about it? Of course, these things are temporary. Again, you can still focus on your pelvic floor exercises because pelvic floor exercises stimulates the whole area of lower abdomen and therefore also stimulates your ovaries that produce some estrogen to get your hormonal status more balanced. Also, it is very important to rest. Whatever you do after birth, you are tired. So a rested body will be more readily to receive sexual stimuli and therefore orgasm than a tired body. Because remember, even that the orgasms is very pleasant thing to experience, they are energy consuming to reach and to have. These are energy consuming, let's say, actions. So therefore, rest after birth as much as possible, of course, within the range of possibility is important. And I would say that rest would come before sex until the certain point. Here we are, I said it. Probably have a bit more sleep and a little bit less sex. If you are breastfeeding or you just gave birth, you might have also drier tissues, dry vaginal tissues, and therefore things might be a bit more uncomfortable. Discomfort equals less focus on the pleasure, equals probably less orgasm. Or even when you are trying to achieve one and you feel that you are getting dry, it's always good to maybe add some lubrications. You can always use either water-based lubricant, a very natural one, but you will have to reapply it during intercourse. You might choose to use also silicone. Another big reason, the third reason why women cannot achieve orgasm has nothing really to do with the actual factual physical injury that might have happened or her being tired. All right, these two are kind of self-explanatory. There has a baby come out through your body, whether it's through your abdomen or through your vagina, and you're not sleeping because baby requires your full attention. This is something that you can have certain influence on, but it happened. A third thing is body image. I have seen countless times women being just so upset about how their body looked, how their vulva looked, how the opening of vagina looked, how the perineum looked, how their abdominals looked after giving birth. They have been so crushed about that image that not only they could not have achieved orgasms, they believe they don't deserve orgasms, they believe they don't deserve to experience pleasure. How could they with this ugly body? They could not even think about sex, not because it would be painful, but because it's just no and no go. This is something to really give yourself some grace and take time to understand that your body has done a massive job. You have done a massive job of producing a human to this world, and there will be change to your body. This said, our body is quite resilient, and even if there is some physical visual changes, it still gives us a possibility to experience pleasure. The range of things you can do. Psychotherapy, seeing psychologists is one of them, and I'm very, very supportive and open about it. I do suggest my clients in a very gentle manner that it is a possibility. Sometimes just taking a mirror, looking at your body, just touching it, also, you know, giving yourself reassurance that this is my body, it's still capable of giving me pleasure. It's great. I would say even in the beginning, it cannot be sex with your partner, it can be masturbation. I'm advocate of healthy masturbation habits, and I think it's absolutely normal, a self-exploration like it happens in the younger years. I think self-exploration and masturbation has its time and place also after giving birth. So you realize how much stimuli you need after giving birth. Has this type of stimuli changed? Has it not changed? And then you can share it again with your partner. Generally, whatever helps you to give yourself a credit, to praise yourself on how great work you have done, just do it. It can be affirmation, it can be meditation, it can be a small notes on the fridge, whatever works for you. Looking at your body, touching at your body, appreciating it. If it's something that is difficult for you, not possible, therapy can be a great tool in here. Number 4, why there is a lack of orgasm after birth. It's again related to the first second, the injury, and to the tiredness, and mainly to the fact that mothers cannot relax in their head and in their mind. It's a well-known fact that we women first get aroused in our head and then in our body. If we constantly have at the back of our mind that, you know, baby will cry, or something will happen, or is my baby okay, this can have a different level of anxiety levels. Sometimes it's normal worry about your baby, and sometimes it can really go overboard. So if it's something that is constantly on your mind 24/7, that the baby will wake up and something will happen, and baby will cry, I'll have to attend immediately. Again, this is something that you can address maybe with a specialist. Another thing is, guys, I said what I said, but you will have to plan your sex life. I think I'm rightly to say that this is it for at least several years for you, that any time of the day you throw up your clothes and you just get down to it. It will unlikely happen like this. Most of the parents need actually to plan their sex life, and by plan I mean very literally open your diaries and write down sex session. However, here I must say, do not put too much pressure on yourself. Let's say Wednesday night, you will write down from 7 o'clock till 9 o'clock. At this time, it's good to arrange some babysitting, or if you don't have babysitting and you learn the pattern of your child, you know that, okay, at this time they might be sleeping, give yourself time, slot to enjoy this time together with your partner. And it might not end up even in the sex. It might end up in a cuddle, it might end up in a massage, it might end up in the sex that will just start and finish, it might end up with whatever interaction, but it should be positive interaction to preserve your intimacy. And also, this is the time when you can switch off your mind, or at least to lower the guard a little bit in regards to your child. You know, this is their sleep time, they will be asleep, let's have some time. Said, sometimes it's the very opposite. You have to seize the chance and use it the way it is without a lot of preparation. Be open to this as well. Baby fell asleep and suddenly you have, I don't know, 40 minutes on your hand, leave the laundry, and if you're there with your spouse and if you're both up to it, just get on it. It's a planned thing where you can relax and you know that things might happen and they might not. In the comments if you actually have planned your intimate life after you had a baby. I know that many parents do, and I think this is a great thing to do. I hope you guys enjoyed this video. Let me know if you want to talk about more details about any topics I have mentioned in this video. Let me know in the comments if you have any more suggestions, or maybe you have questions. You can also follow me on my social media and send me DMs in there. It's always a great discussion. Thank you so much for liking this video. Thank you for subscribing. I hope you have a great day and plenty of wonderful orgasms. Take care. We'll see you soon.